Hi, Mr. Smith. We're going to go over your prescribed medication today. First, I'd like to just go over your health history real quick. So, you're 49 years old, a male, and you're overall in good health. Your blood pressure is 134/79 with a pulse rate of 77, and your breath sounds were clear bilaterally. All of your blood work returned all within normal limits, so that's good. And you have been prescribed this medication to help with mild depression, is that correct?
Yes.
Okay. And this medication that you've been prescribed is fluoxetine 20 milligrams. They're capsules, and they should be taken twice a day, preferably the morning and in the afternoon. You can take this medication with food if it upsets your stomach at all. The key points of your medication administration is to not miss a dose. If you've realized that you've missed a dose and you have a couple hours until your next dose, you can go ahead and take it. But if it's too close to the next time of your dose within an hour or so, just skip it and start with the next prescribed dose. It's also very important that you not stop taking this medication abruptly because that can cause anxiety, insomnia, and some nervousness. So if you think that you want to stop this medication, please call our office and we will talk to you about that. So with this medication are some side effects. They're rather mild, and the normal side effects that you would find with this medication is nausea, diarrhea, headache, and insomnia. But there's also just a few adverse effects that we need to know immediately if you have any of these adverse effects so we can make arrangements to either take care of them or to change your medication. So the first one is suicidal thoughts. If you have any new or sudden changes in your mood or your behavior, your actions, your thoughts, or your feelings, please let us know immediately. This drug can also cause serotonin syndrome. Because the way that this medication works is it allows for there to be a lot of serotonin in your body, which is serotonin is the hormone that makes you happy, basically. But if you have too much of that in your body, it can cause serotonin syndrome. And the symptoms of that are agitation, hallucination, coma, or other changes in your mental status. It can also affect your coordination, like give you muscle twitching, a racing heartbeat. You can have high or low blood pressure, sweating or fever or muscle rigidity. You'll just be real tense. So please make us aware of any of these side effects. It also can cause some abnormal bleeding, especially you're at risk for bleeding if you take this medication along with a blood thinner like warfarin, or if you take NSAIDs like ibuprofen or naproxen or aspirin. So please report to us if you have any dark or tarry stool or any unusual bruising. And another side effect that's not necessarily serious or would cause a major health issue, but we need to discuss, is that it may cause a decrease in your sex drive. So just know that that is something that is normal, but you are more than welcome to talk to the doctor about that if you would like to. So now that I've gone over that, I would like to know that I conveyed everything that I should have. So if you don't mind, I would like for you to tell me what you understood about how you're supposed to take this medication.
Twice a day, once in the morning and once in the afternoon, and take it with food if it upsets your stomach.
Okay, good. Was there anything else that you remembered about that?
Yeah, not to take a double dose, and to if you miss a dose and it's really close to your next dosage time, just skip that one and go on take your regular prescribed dose, and not to abruptly stop taking it.
Okay. And what might you experience if you abruptly stop taking this medication?
Anxiety, insomnia, nervousness.
Okay. And what are the common side effects, the mild side effects that you might experience while taking this medication?
Nausea, diarrhea, headache, and insomnia.
Okay. And there were also a couple of more serious adverse effects. What do you remember about that?
Suicidal thoughts or actions. sudden mood changes, serotonin syndrome, abnormal bleeding, and a decrease in sex drive.
Okay, and you'll call our office if you experience any of those, correct?
That's right.
Right, very good. Okay, do you have any other questions for me?
No, I do not.
Okay, well, thank you, Mr. Smith.